Doctors, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? 1. I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself. You couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, and what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. 2. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself. For example, labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. 3. Don't get involved in the management. I let the doctor see me lead that unless they miss something huge, and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. 4. Doctor here. Neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about. That being said, the doctor usually knows I'm a physician as well, and so the language terms are more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. 5. My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds, etc. Then yes, they do discuss stuff like it's a group project. 6. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. 7. Doctor here. Family medicine. I self-diagnose most things, but for my 1-year-old daughter, I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent, and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist, for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with it. He patients. BC, he can be sure I understand the medical pros and cons well once I'm given a basic explanation.